All right, the doctor is in. It's time for Doc Talk, where we take your questions to our experts. Dr. Dina Tom joins us now. She's a pediatric hospitalist with University Health and UT Health San Antonio. Doctor, thank you for joining us, first of all.
Thank you for having me.
All right, we get a lot of good kid questions, so that's right up your alley. The first one, can I give my 5-year-old cough medicine?
Well, the short answer is maybe.
Okay.
So years ago, the FDA pulled a bunch of cough medicines from the shelves because we know that some cough medicines have side effects. It can make their heart race, it can make them breathe harder and faster, blood pressure to go up. So the easy answer is that your kid is under 4 years old? No, not at all. It's not safe to take over-the-counter cough medicine, and likely it's not safe to take even prescription, but talk to your doctor because that may be the case.
Even children's cough medicine?
Children's cough medicine is approved over 6 years old, and between the ages of 4 and 6, it's important to talk to your doctor because it's possible that it would be safe, but over 6, you can read the label and feel okay with children's cough medicine. Never use adult cough medicine for kids.
And for the little ones under 6, I mean, they need something to clear that. Their cough clears the gunk, right?
Yes.
They need to do that.
Yes, so all parents know that the cough is so irritating to listen to and really uncomfortable to watch your kids go through that. So there are some safe things that you can do for your child who has a cough. The first one, and it's actually been studied, is honey. So if your child's over 1 year old, never give your child, your baby honey if they're under 1. But over 1, it's actually been proven that if you give them a teaspoon of honey at night before bed, that they will cough less. Lots of fluids, making sure that they're drinking a lot is important also.
Okay, let's talk about something that often accompanies the cough, fever. So when your child has a fever, when should you worry, and what over-the-counter medications are safe?
Yes, good question. So fever is normal. And that's one thing I counsel my parents and patients about, is that a fever is a normal response for your body to fight infections. So it's actually a good thing when your child mounts a fever. The reason we would want to treat it is really to prevent our children from being uncomfortable. And like my daughter, when she gets really high fevers, every time like clockwork, she throws up. And so I don't want her to get a high fever because I don't want her to go through that. But in and of itself, it's safe. Over about 102, we want to treat it. So just because that can be uncomfortable. And it's safe to treat it over the counter with Tylenol and ibuprofen. Make sure that you get the children's kind and look at the label. For children under 6 months old, we don't want to use ibuprofen. It's not approved. So Tylenol is safe, and look at the label. And then if your child's under 3 months old, they need to see a doctor because that's an age where they can have a serious infection and we don't want to ignore it.
So Steve's going to know I have so many follow-up questions.
I know.
Because
I'm bowing out of this one.
You hear me complain about this all the time.
Good. That's okay.
But if a fever is a good thing,
yes,
and you treat the fever, you make it go away with medication, does that delay fighting the illness in any way?
Not necessarily. It's your body's response to infection, and we know that certain infections don't live well in a warmer environment. But the younger the child, they tend to have crazy fevers. Their fevers can get really high, and it scares us as parents. And then, if I have a fever of 101, I'm sure I'm dying, right? Yes. So it's really important to make sure that your child is comfortable, most of all. But no, it's okay for you. Just don't try to prevent the fever because you don't want to just be giving medications when you're not sure that your child will actually have a fever. So really, we don't want to treat it until it gets over 100.5.
Okay.
And then if they're uncomfortable, it's fine to give it. And if they're not uncomfortable and you just know it, try not to flip out and just give it. Just let them play and eat and drink.
Okay.
All right, this next question is kind of a struggle that I've had many times. How can I protect my kids at the beach from the sun?
Yeah, good luck with that.
I know, because I know the suntan lotion isn't always going to stay on so great.
Nope.
Yes. Well, the sun is not going to go away, especially in Texas if you're going to the Texas beaches. And the best thing to do, honestly, the easiest thing to do is in the purchase of the clothes for your kids. So thankfully, it's becoming more of a trendy thing that kids are wearing rash guards and swimsuits that are long.
Oh, I love it.
Me too. I love it.
Less surface area for sunscreen.
Yeah.
Me too. So, a hat and clothing. A lot of swimsuits and different kinds of hiking gear and things, if you're outside, they really do have sun protectant in it. So you can look for that. And then you want to apply sunscreen every 2 hours, which seems, like a lot if you're out in the sun for the day. But really focus for kids, it's safest to use a mineral-based sunscreen. So zinc oxide or titanium dioxide, if you look at the back on the ingredients. I think the easiest ones are the sticks.
Yes.
So you just buy the sticks and you rub it all over. I did that last week for my son. It was a purple stick. I didn't realize, so he looked purple. But I knew he was protected from the sun.
I have a redheaded daughter, so we put on lots of sunscreen, especially on her face, so she would go to the beach looking like a ghost.
Yes.
Yeah. And that's okay, though.
Yeah.
Well,
that's
and
all
they
right.
do make tinted sunscreens now. So, that's helpful if you have darker skin and you don't want to look like a ghost.
Like a ghost.
Yeah.
Okay, before we get to the beach in summertime, here's a question about spring break. What can parents do to help kids go back to school rested and healthy after spring break?
Yes, we're all looking forward to spring break. Spring break is a time we stay up late and sleep in, and we throw caution to all schedules. But it is important to remember that it's not that long. It's not summer break. So really start thinking about when the end of spring break is approaching, Thursday, Friday, really start to think about what ways you can prepare your kids to go back. And one easy way throughout the week is really to try to keep this a similar schedule in terms of waking up in the morning, brushing their teeth, having breakfast, and at night maybe doing the same thing you do every night, reading to them before you go to bed. But about Thursday, Friday, really try to pull back their bedtime a little bit, have them wake up a little bit earlier to get them prepared to go back. And it doesn't hurt to keep, parts of their schedule if they're working on music or doing math. I know that seems crazy because it's spring break, but it will help them when Monday comes and they got to go full on in. Yeah.
And we're also springing forward during spring break.
I know.
The Sunday before. Lucky us.
We actually have to get our teenagers up before noon.
Yeah.
Oh, I don't even know what that is like. That is a foreign world for me.
Just wait. All right, by the way, we want your questions for this segment. So there's a QR code we want to show you right now. If you have a question you want us to ask our group of doctors, we would love to. Just scan the QR code to submit your questions. Dr. Dina Tom, thank you so much.
Yeah, thanks for being here. This was great.
Thank you for having me.
Your first time.
My first time?
You're like a vet.
Oh, okay.
Yeah.
We'll see you back here.
Yeah.
Thank you.
Thank you for watching KSAT 12. If you are on YouTube, you can like and subscribe so you can stay up to date on all the latest news and weather here in San Antonio.